Good afternoon, everybody. My name is Carissa. I am the director of Considerate Cultures in Sweden, which is a global consumer advocacy group. So I'm coming at this from a very much consumer perspective. I'm really happy to be here and discuss these topics with you. Our fight against smoking has become stagnant. With traditional tobacco control measures, countries don't seem to be able to lower their smoking rates less than 10%. In the European Union, the average smoking rate is about 20%. So we must urgently find solutions to this problem. There are 1 billion smokers in the world, facing the detrimental health consequences such as illness and death because of it. Smoking is the leading cause of preventable death and disease, so we have to find solutions quickly. No country has ended the use of nicotine, but some has vastly reduced its harm. Sweden is one of the leading countries about to become declared smoke-free. And Sweden has presented a new solution to smoking, and it's working thanks to harm reduction principles and safer nicotine products, such as Snus and nicotine pouches. All smokers and consumers are not created alike. One smoking cessation tool will not work for all groups of society or work for the whole population. They will not affect women and men equally. They won't affect a 20-year-old or a 60-year-old equally, or high income versus low income, or even healthy versus sick. Tobacco control measures puts in light that it's not only about smoking, it's also about health inequality and injustice and marginalization. Our inventions will hit differently. For example, in the US, the indigenous people have a higher prevalence of cigarette smoking, highest among all ethnic groups. And very interesting to me, as a psychology student, people with schizophrenia have very high smoking rates, calculated up to 80%, which is really disproportionate. In order for a country to become smoke-free, they need to be able to cater to all of these different groups. And that is something that Sweden had to learn in order to get to where they are today. Snus has been around in Sweden for a very long time, hundreds of years, and it's kept legal because of our exemption from the ban on oral tobacco in the European Union. That led to the fact that men quit smoking to use snus in a larger extent than women did, because snus is not a product that appeals to women. It tastes very heavily of tobacco, it stains your teeth, and it also creates a sort of disgusting breath, to be honest. So women didn't want to change to this product instead. As a result of that, many women continue to smoke, and as we saw in the statistics, male occurrence of lung cancer is a lot lower than for women. And this really tells the story about how women, they were not benefited in the way that men were in Sweden. And I think that's really, really powerful. And in most countries, it is the opposite situation where women are usually the more healthy than the men. So it's really, really interesting. But then something changed. Nicotine pouches were invented and introduced to the market. Accessible, affordable, and acceptable. And nicotine pouches, they don't have that strong tobacco flavor, the staining on the teeth, or the bad breath for that matter. During the following years, women finally started to switch from smoking to using nicotine pouches. And the smoking rates among women declined from 11.2% in 2015, which was just before the arrival of nicotine pouches, to 5.7% today. So, this switch was what made it possible for Sweden to become smoke-free. where smoking rates in the whole population declined from 10% in 2015 to just about 5% as we have now. It would not have been possible without catering to the different needs of these different groups and demographics. Another consumer group that have been affected positively by nicotine pouches in Sweden are young adults. In fact, it's been so impactful that we now have a smoke-free generation, my generation. People aged 16 to 29 have a smoking prevalence of 2.3%. That's unremarkable. It's something completely unique. Before that was the number was 7.2%. So it's a really large decrease. My own story is true for both of them. I am a young woman who stopped smoking because of nicotine pouches. A story I share with many women my age in Sweden. I usually say that I'm very lucky to be a woman that was born in Sweden. I'm lucky to have access to safer alternatives. My mother and her generation, they did not have that. Today, as I speak, many women all over the European Union don't have access to that. And the EU is looking to ban nicotine pouches or restrict flavors, which is one of the most appealing parts of nicotine pouches for women, depriving these women of their life-saving, life-quality enhancing products, something that could save their life. This tells us about the importance of not only innovation and safer alternatives, but also it tells us that we need to embrace it too when we have found something that actually works. We need to look at what is actually working, and in Sweden we have a really great example of that. This is urgent. Every year that passes is translated into lives that could have been saved while we wait for politicians and legislators to catch up. And I must add that harm reduction, it is something that has been tried in many fields of medicine and health. Harm reduction is not something new. Sweden's success was a slow, consumer-based process. It took place organically over many, many years. If governments were to decide to put all their energy and effort into promoting low-risk products, combating misinformation, and they could achieve what Sweden has done in a lot less years. They would be able to do it a lot faster, as we can see, for example, in New Zealand, and also give some of the examples we talked about earlier here today. We need sensible legislation on product standards, underage use prevention, transparent labeling. It must preserve access for adult consumers who need alternatives now, and the safer alternatives have to be affordable and taxed relative to the risk of the product. And we really need relative risk communication from the health agencies in each country. Every time I speak to a poucher who says they feel healthier, more confident, or simply freer, I am reminded why this work matters. Nicotine pouches may be small, but their impact is anything but. As Sweden moves towards becoming smoke-free, I hope more countries will look at what it is doing and dare to follow. Let's not waste time trying to reinvent the wheel when the evidence and the voices of consumers, as well as real-life examples, already exist and are pointing the way. Thank you.